7:45 in Trinidad and Tobago. Well, May is Healthy Vision Month, and that is why we've invited Dr. Ronnie Bhola, the Chief Surgeon and Consultant Ophthalmologist at CVRS and Trinidad Eye Hospital, to be with us. Dr. Bhola is also a 9-time Skeletrix champion, because I heard the name and I said, well, wait now. You remember the old days when Peter de Montbrun used to have that competition, Skeletrix competition, probably late 1970s, early 1980s, and he always had a bowler winning. Well, this is the man, Dr. Ronnie Bhola, so you probably need good eyesight to ensure that you watch your Skeletrix car going around the track. Dr. Bhola, very good morning to you. Thanks for joining us.
Thank you for having me, Fazeer. And we used to come around the Coca-Cola bend.
Indeed, indeed. Well, we'll send you that bill for the free advertising for the soft drink as well. But as we talk about vision and eye health and so on, what would you like to highlight with this Healthy Vision Month?
So, healthy vision, the first thing I like to think about when we think of healthy vision is what is healthy vision? What is vision? And I like to think of vision as having, somebody having really good central vision, and people really know what central vision is, because we always talk about 20/20 vision. And 20/20 vision is basically your ability to see things clearly for reading, for seeing signs on the road, and that sort of thing. But we must remember that vision is not only central vision, but something called peripheral vision. And peripheral vision is as important as central vision. And a lot of conditions that affect peripheral vision is not picked up until it's too late to treat it. And that's one of those specific conditions that we're talking about is glaucoma. And glaucoma is the most blinding condition that we see in this country, in Trinidad. And therefore, it is important to screen for eye conditions on at least a 2-yearly basis once you cross the age of 40, is what I would be thinking.
Okay, so let's talk about, and from what we understand as well, the eye hospital has moved its location from St. Augustine to Paget along the highway area there. So if someone wants to establish a baseline, whatever their age might be, what do they have to do to get an appointment? What's the process? Do they have to go online? Do they have to come in person to make that appointment?
Yes, so all they have to do is they call us on our numbers. They'll find it online, trinidadeyehospital.org. They contact us and come in and have their eyes checked. And that's one of the things in Healthy Vision Month that we want to promote. We want to promote healthy eye living. And one of those things is to get your eyes checked at least once every 2 years. If the eyes have been deemed healthy, then once every 2 years or so is enough. And you call us and you come in, and the eye doctors there would screen the eye, make sure you don't have, the glaucoma. If you're diabetic, we'll make sure that you don't have any complications from the diabetes, like bleeding in the eyes. We look for cataract, which is very common. And one of the most common things that we see is refractive error. And, a lot of people walking around thinking, I might have something serious going on with the eyes because it's a bit blurry. And really all they might need is just to change their glasses or a pair of glasses. So, just be aware that you should come in and let us screen and look for conditions that you may not know you have.
And just on that point, Dr. Bhola, you said once every 2 years should suffice, but does that depend on age and complications? For example, if you're over 50 and diabetic with complications, should you be coming in every 6 months or once a year to check on your eyes?
So definitely, Fazeer, I like that question. I think if you have a family history of something like glaucoma, then we usually recommend once a year we run the glaucoma screen, which is a visual field, optic nerve head analysis test. And we do a dilated fundus examination and look at the eyes in detail to look and see if you're developing even a small chance or sign that the glaucoma is coming, because you have the family history of it, and it's very common in families. The other thing, and that group that you specifically talked about, the diabetics, they are a special group. if we look at your eyes and we start to see early changes from the diabetes, because we could pick it up in the eyes before it starts to affect other organs in the body. So once a year, if we don't see anything, but if we see anything, we usually see much more frequently, either 3 months or 6 months, depending on what we see when we look at the eyes and do the scan.
And of course, Dr. Bhola, people can go on the website to get a lot more information. It's, of course, www.trinidadihospital.org. You can call 235-4834 to get more information at their new location at the corner of Paget Road and the Churchill Roosevelt Highway. But just on the point that you alluded to, that people may see feeling the eyes a little blurry, they might say, well, they just maybe are tired this morning, or they might have some issues with peripheral vision. And they might say also, because we have to face financial realities, they might say, look, I don't want to go and check this because next thing you know, I have to find out I have to get a $10,000 operation or something. What would you say to those as far as prevention being better than cure, and at least check and see what the issue is?
Yeah, I would say once like if you're diabetic and you've been recently diagnosed, in the early stages, if you have, if we pick up that you have the early signs, then these signs are reversible. With simple measures like dietary change, like changing your lifestyle, because it is a lifestyle disease. If you wait until you start to develop the bleeding in the eyes or the problems with the retina, which is retinal detachment, then you're running high bills. You're running the bills in the thousands. But if you start early and you're very proactive in getting your eyes screened, then you really have a very small bill at the end of the day. And things like glaucoma, if we pick you up, really early, then all you're doing is putting drops in, and you'll control the disease. Other than you waiting until it affects your vision, then you lose your job because you can't work, and that's the reality.
Doc, I'm looking at some of the guidelines to improve eye health, and they really have to do with a healthy lifestyle. I mean, eat right to protect your sight, maintain a healthy weight, quit smoking, wash your hands to protect your eyes, rest your eyes, apart from the exams and so on, knowing the family history. But it does sound like, as in many cases, when we talk about general lifestyle and wellness, it ultimately comes down to healthy living, doesn't it?
Yes. And, knowing that is a big thing. And that's why Healthy Living Month, what is happening here, where me and you reaching out to the public, bringing them this information that you are empowered to take care of your own eye health, makes a big difference, because now they know if anything happens to my eyes, I really have the power to either change it, or I have the power to take action early and prevent problems from occurring.
And therefore, before time runs out on us, Doc, what would you like to say to the general public as to the importance of knowing your status? Because I mean, it's taken me a while to learn as well. But as I get older, I realize that if I were to do my annual checkup or what prostate checks and whatever, at least I'm reassured in knowing that this is the situation. Whether it's prostate, whether it's eye, whether it's cardio, whatever it is, you feel comfortable in knowing that, yes, it's cost a few dollars, but as far as your sense of feeling good about yourself, that you're on the right, that it saves you a lot of worry to at least know what your status is on a regular basis.
And that's one of the things I find, Fazeer. People come in just because they want that reassurance that they are on the right path in terms of their eye health. So they come to us for that peace of mind. And when they come, I like that we could give them that peace of mind by telling them, well, you don't have the glaucoma, there's no bleeding in the eyes, we're not seeing any cataracts in the eyes, and you're seeing 20/20 vision. And that's one of the beauties of doing the annual checks on the eyes. And I like that you highlighted on the fact that if they have a healthy lifestyle, and that's one of the things when they come into us, we tell them, here what, for your eyes, I want you to make sure you're wearing shades when you go out in the sun. In this part of the world, the sun is very bright. There's a lot of UVA, UVB in out there. You want to protect your eyes. So we are able now to give them these tips that will help them. Because when you have knowledge, you become empowered to be able to take care of your health and yourself.
And Doc, before we conclude, just to remind everybody again, you can go on the website www.trinidadihospital.org for more information. You can call as well at 235-4834. You could WhatsApp 686-8482 for more information. And very selfishly, I just want to squeeze in a few more seconds. You still have all your Skeletric cars?
My brother is a fanatic at this age. Almost every day, these guys still race. You can imagine that.
We can't get enough of this Skeletric. Dr. Ronnie Bhola, thank you very much indeed for taking the time to be with us.
Thank you.
You're more than welcome. 9-time Skeletric champion, but now very much focusing on healthy vision. As we go to another break, here are some plant images that have been sent to us. It's the Aglaonema plant sent to us by Marsha Alicia Barrington.